When was the last time you really, and I mean really, looked at your feet? Not just a quick glance when you're putting on your socks in the morning. I'm talking about sitting down, taking off your shoes, and actually examining them. The skin, the nails, the color, the temperature. Most people never do this, and I completely understand why. We're busy. Our feet are just there. They carry us through the day, and we don't think much about them unless they hurt. But here's what I've seen in over 20 years of caring for older adults. Your feet can be the first place your body starts whispering a warning that something serious, like diabetes, may be developing. My name is Dr. Ethan Carter. I'm a physician specializing in geriatric healthcare, and today I want to talk to you about 10 warning signs in your feet that could mean you have diabetes, or that your diabetes is progressing in ways that need immediate attention. Now, I know that word, diabetes, can feel heavy, but here's what I always tell my patients. Knowledge is not a reason to panic. Knowledge is power. The sooner you recognize these signs, the more options you have. And many of these symptoms, caught early enough, can be slowed, managed, or even reversed. According to the CDC, nearly 37 million Americans are living with diabetes right now. And here's the number that truly worries me. About 1 in 5 of them have no idea. They haven't been diagnosed yet. And the older we get, the higher our risk becomes. If you are over 60, this video was made for you. So please, stay with me. Watch until at least sign number 7, because that is the one that surprises almost everyone, including people who consider themselves very health conscious. Let's start from the ground up, literally. Sign number 1, numbness or tingling in your feet. You may have noticed it already. A sensation like your foot has fallen asleep, even when you haven't been sitting in an unusual position. Or a pins and needles feeling in your toes that comes and goes. This is one of the most common early signs of diabetic peripheral neuropathy, nerve damage caused by prolonged high blood sugar levels. When glucose stays elevated in your bloodstream over months and years, it gradually damages the small nerve fibers throughout your body. And because the nerves at the ends of your limbs are the longest and most vulnerable, your feet are almost always the first to be affected. According to the American Diabetes Association, nearly 50% of people with type 2 diabetes will develop some form of peripheral neuropathy during their lifetime. Many of them report that tingling or numbness was the very first sign they noticed, often years before they received a formal diabetes diagnosis. Now, what makes this particularly important for people over 60 is this. We tend to normalize discomfort as we age. We tell ourselves, oh, my circulation is just getting worse. It's old age. And sometimes that's true. But please, don't assume. If you're experiencing recurring numbness or tingling in your feet, that deserves a conversation with your doctor. What to do? Note when it happens, how long it lasts, and which parts of your foot are affected. Bring that information to your next appointment. Sign number 2, a burning or painful sensation in your feet. This one is different from numbness, and in some ways, it's harder to live with. Instead of losing feeling, some people experience the opposite, an intense, burning pain, especially at night. Patients have described it to me as walking on hot coals, or a deep aching that makes it impossible to have a sheet touching their feet while they sleep. If that sounds familiar, please pay close attention. This symptom is often linked to small fiber neuropathy, damage to the tiniest nerve fibers responsible for detecting pain and temperature. When these fibers malfunction due to high blood sugar, they can send out false danger signals, even when there's no actual physical threat to your foot. For older adults, this matters deeply because poor sleep caused by nighttime foot pain leads to a cascade of health problems: elevated stress hormones, higher blood sugar, reduced immune function. It creates a cycle that makes everything worse. And here's something important I want you to hear. Burning foot pain is not something you should just push through. It is a signal. Don't mask it with over-the-counter pain relievers for months without finding the cause. What to do? Track the pattern of your pain. Does it worsen at night? Does it improve with walking or stay the same? This information is medically valuable. And do not delay. There are effective treatments available once the cause is identified. Sign number 3. Swelling in your feet or ankles that won't go away. Now, swollen feet and ankles are common in older adults for many reasons: standing for long periods, the heat, even certain medications. So how do you know when it's something more serious? Here's what I look for. Swelling that is persistent, present in the morning when you wake up, or getting progressively worse over weeks. That kind of swelling, particularly when combined with other symptoms on this list, deserves medical evaluation. In the context of diabetes, persistent swelling can point to several things happening simultaneously: poor circulation, early kidney stress from high blood sugar, or damage to small blood vessels in the legs. Diabetes puts enormous strain on the kidneys over time, and when the kidneys begin to struggle, fluid retention is one of the earliest visible signs. There's a quick test you can do at home. Press your thumb firmly into the swollen area on your ankle or the top of your foot. Hold it for about 10 seconds, then release. If the indentation remains, what doctors call pitting edema, that is a sign that needs prompt medical attention. Not tomorrow, today. What to do? Check both feet at the same time of day. Morning is best. If one foot is significantly more swollen than the other, or if the swelling is accompanied by redness, warmth, or pain, call your doctor the same day. Sign number 4. Wounds or sores on your feet that are slow to heal. I want to spend a little extra time on this one, because, in my experience, it is the sign most directly connected to serious, life-altering complications. Think about a small cut on your finger. For a healthy person, that heals in a few days. Now imagine a small blister on your heel, or a minor scrape on your toe that simply doesn't heal. Days turn into weeks. The wound stays open or gets worse. This is a diabetic foot ulcer in its early stages, and it is a medical emergency. Here's the biology. When blood sugar remains elevated, it does two things that impair healing. First, it suppresses white blood cell activity, the cells your immune system sends to fight infection. Second, it interferes with the production of collagen, the protein your body uses to repair tissue. The result? Wounds that linger, become infected, and, in severe cases, cannot be saved. The statistics here are sobering, and I share them not to frighten you, but because I believe you deserve to know the truth. According to the American Diabetes Association, a lower limb amputation related to diabetes occurs approximately every 17 seconds in the United States. The vast majority of these amputations are preceded by a foot ulcer that was not treated aggressively enough, early enough. And here is what makes this especially dangerous for people over 60. Because of neuropathy, the nerve damage we discussed in signs 1 and 2, you may not feel the wound at all. You could have an open sore on the bottom of your foot right now and be completely unaware of it. What to do? Make it a weekly habit to inspect every surface of your feet, including the soles and between the toes. Use a mirror if you need to. If you find any wound that has not improved in 2 weeks, see a doctor immediately. Sign number 5. Severely dry or cracked heels. Dr. Carter, everyone my age has dry skin. How is this a diabetes warning sign? I hear that question often. And you're right, dry skin is common as we age. But there is a meaningful difference between ordinary dryness and the deep, painful cracking that can indicate a diabetes-related problem. When diabetes damages the autonomic nerves, the ones that control automatic functions your body performs without conscious thought, one of the first things to be affected is sweat production in the feet. The feet literally stop sweating properly. Without that natural moisture, the skin becomes extremely dry, loses its elasticity, and begins to crack. Now, a surface-level crack is a cosmetic issue, but a deep crack at the heel, especially one that bleeds, that is now an open wound. And as we discussed with sign 4, any open wound on a diabetic foot is a potential entry point for infection. I've had patients come to me with what they assumed was just a dry heel, and it had become infected deep into the tissue. These situations can escalate frightening quickly. What to do? Moisturize your feet daily, but avoid putting lotion between the toes, as that can create moisture and fungal growth. Use a thick cream, not a light lotion. And if you have cracks that are deep or bleeding, cover them and see a doctor or a podiatrist, not just a pedicurist. Sign number 6. Changes in the color of the skin on your feet or lower legs. This is one where I want you to start paying closer attention to what normal looks like for your feet, so you can notice when something has changed. 3 color changes I find particularly significant. First, a dark, dusky red or purplish tone, especially when your feet are hanging down. This can indicate that blood is pooling because it cannot circulate properly back up through the veins. Second, a pale, almost whitish appearance when your feet are elevated. This suggests that arterial blood is not reaching your feet effectively. Third, a bluish or grayish tint, which can indicate severely reduced oxygen in the tissue. This is urgent. All of these can be signs of peripheral artery disease, or PAD, a condition where the arteries that supply blood to the legs become narrowed or blocked due to plaque buildup. PAD is significantly more common in people with diabetes, and the two together create a dangerous combination. According to the American Heart Association, PAD affects approximately 1 in 3 people with diabetes over the age of 50. And because it often develops quietly, without obvious pain, many people don't know they have it. What to do? Next time you're resting, take a moment to look at both feet side by side. Are they the same color? Do they look different when elevated versus hanging down? Bring any observations to your doctor. These are exactly the kind of details that help us diagnose PAD early. Sign number 7. This is the one I promised you. And I can tell you, in 20 years of practice, this is the sign that catches almost everyone off guard. Look at your toes and lower legs. Do you have hair there? And more importantly, did you used to have more? Hair loss in the toes and lower legs is one of the most reliable and most overlooked early signs of peripheral arterial disease. Here's why it happens. Hair follicles are among the most metabolically active structures in the body. They need a constant, robust supply of oxygenated blood to grow. When circulation to the lower legs is compromised due to arterial narrowing, the hair follicles are among the first to suffer. They don't produce pain. They don't swell. They simply stop growing hair. And because it happens gradually, and because many people assume that hair naturally thins on the legs as we age, which is somewhat true, this sign flies completely under the radar. But in clinical practice, when I examine a patient's feet and I see smooth, hairless toes and a hairless lower leg, that is a significant red flag. It tells me that circulation has likely been compromised for some time. I want you to do something right now if you can. Look at your lower legs and toes. Compare the two sides. Is the hair sparse? Is it absent entirely on the toes? Has it changed compared to how it looked 5 or 10 years ago? What to do? Mention this to your doctor. Ask specifically about an ankle brachial index test, or ABI. It's a simple, painless, non-invasive test that measures blood pressure in the ankle versus the arm to assess circulation in the legs. It takes about 15 minutes and can detect PAD before symptoms become severe. Sign number 8. Recurring fungal infections or thickened, discolored toenails. You've probably heard of toenail fungus. It's extremely common. But here's what many people don't realize. People with diabetes get toenail fungus at roughly 3 times the rate of the general population. The reason is straightforward. Elevated blood sugar creates an ideal environment for fungal organisms like Candida to thrive. And because the immune system in people with diabetes is often less efficient at fighting off infections, a fungal infection that a healthy person might clear on their own can persist, spread, and cause significant damage. What does it look like? The nails become thickened, brittle, and may turn yellow, brown, or even black. They can separate from the nail bed. The skin between the toes may become red, itchy, and scaly. That's also fungal. Now, you might think it's just a cosmetic issue. Embarrassing maybe, but not dangerous. And I understand that instinct. But here's why I take it seriously. A thickened, misshapen toenail can create pressure points and skin breakdown underneath the nail. In a foot that already has reduced sensation and poor circulation, that breakdown can quietly progress into an ulcer. What to do? Keep feet clean and dry. Change socks daily. Moisture-wicking material is best. Don't go barefoot, especially in communal areas. If you have recurring or persistent fungal infections, talk to your doctor about prescription-strength antifungal treatments. Over-the-counter options are often insufficient for diabetic patients. Sign number 9. Unexplained deformity or dramatic swelling in one foot. What doctors call charcot foot. This is a less commonly known complication, but one I feel I must include because it is serious, it is underdiagnosed, and it disproportionately affects people over 60. Charcot foot, named after the neurologist who first described it, is a condition where the bones in the foot weaken and begin to fracture and collapse. often without the person experiencing significant pain. Why? Because of severe neuropathy. When you lose the protective sensation that would normally tell you something is wrong, you continue walking on bones that are fracturing and shifting. The result is a foot that becomes dramatically swollen, warm and red, often mistaken for an infection or a sprained ankle. Without treatment, the bones collapse and the foot takes on a rocker bottom shape, flat on the bottom, almost like a half moon from the side. This deformity creates abnormal pressure points that are prone to severe ulceration. Here's what I want you to take away from this. If one foot becomes significantly more swollen, red, and warm than the other, particularly without a known injury, go to the emergency room or an urgent care facility the same day. Do not walk on it. Charcot foot caught in its early stage can be treated with immobilization and offloading. Caught late, the outcomes are far more complicated. What to do? Be aware of this condition. If you have significant neuropathy and one foot looks dramatically different from the other without explanation, treat it as an emergency. Sign number 10. Feet that are persistently cold, even in warm conditions. Now, everyone's feet get cold sometimes. Cold weather, sitting still for too long, poor circulation that comes naturally with age, these are all legitimate reasons for cold feet. But what I'm describing here is different. Feet that feel cold to the touch even when the rest of your body is warm, or that remain cold no matter how long you're bundled up. Feet that, if you touch them compared to your calves, feel distinctly colder. This is a sign that arterial blood flow to the feet is significantly reduced. The heart is pumping warm, oxygenated blood, but because the arteries are narrowed, again, think PAD, that blood is not reaching the extremities effectively. In isolation, cold feet might not tell us much, but combined with any of the other signs we've discussed, the color changes, the hair loss, the numbness, cold feet become part of a pattern that points clearly toward vascular or neuropathic disease. I also want to mention something specific to older adults. Many of my patients have been told by previous doctors that cold feet are just part of getting older. I want to respectfully push back on that. Yes, circulation slows with age, but cold feet that are also pale, numb, or associated with leg cramping during walking deserve investigation every single time. What to do? Do the comparison test regularly. Touch the top of your foot, then your lower calf. Is there a notable temperature difference? And if your feet are cold and numb and discolored, that is a conversation to have with your doctor this week. All right, we've covered 10 signs, and I want to be clear about something important. You do not need all 10 of these signs to take action. You don't even need 5. If you have 2 or more of what I've described today, I want you to schedule an appointment with your doctor before this week is over. Not next month, this week. And here is a quick checklist for what to say when you get there. Tell your doctor, I've been noticing, describe your symptoms, and I'd like to be evaluated for diabetes or circulation issues in my feet. Then ask specifically for 1. A fasting blood glucose test and an A1C test. These give us the clearest picture of your blood sugar over time. 2. A foot examination. It sounds basic, but studies show that comprehensive foot exams are often skipped during routine visits for older adults. Ask for it specifically. 3. An ankle brachial index test if you have any of the signs we discussed related to circulation, the hair loss, skin color changes, cold feet, or swelling. And please, if you find an open wound on your foot, or if one foot becomes dramatically swollen, red, and warm without explanation, do not wait for a scheduled appointment. Go to urgent care or the emergency room that day. I've seen simple wounds become limb-threatening infections in less than 72 hours in diabetic patients. I'm not saying this to frighten you. I'm saying it so you never have to learn that lesson firsthand. Now, let's talk about what you can do starting today, whether you have diabetes or simply want to protect yourself. The most important thing is blood sugar control. Every other protective measure sits on top of this foundation. If your blood sugar is chronically elevated, every single sign we discussed will progress faster. If it's well managed, many of these changes can be significantly slowed or even partially reversed. Work with your doctor on a management plan that includes diet, exercise, medication if needed, and regular monitoring. There's no shortcut here, but there is a clear path. Second, daily foot care. Here's the 5-step routine I give every one of my patients. Step 1. Wash your feet every day in lukewarm water. Not hot, because neuropathy can prevent you from feeling a burn. Dry them thoroughly, especially between the toes. Step 2. Inspect your feet every single day. Top, bottom, sides, between the toes. If you can't bend to see the bottom, use a mirror on the floor or ask a family member to help. Step 3. Moisturize with a thick foot cream, but skip the space between the toes. Step 4. Trim toenails straight across, not curved. Curved cuts increase the risk of ingrown nails, which can cause infections in people with diabetes. Step 5. Never go barefoot, not even inside your home. A small piece of glass, a sharp corner of furniture, a nail, things that would cause a minor injury in a healthy person can escalate in a diabetic foot. Wear well-fitted, soft shoes or diabetic slippers indoors. Third, your footwear matters more than you may realize. If you have diabetes or prediabetes, ask your doctor about therapeutic or diabetic footwear. These shoes are specifically designed to reduce pressure points and accommodate any foot deformities. Medicare Part B often covers diabetic shoes for qualifying patients. Your doctor can help you navigate this. Fourth, gentle movement helps. You don't need to run marathons. Even 30 minutes of light walking per day, broken into shorter intervals if needed, improves circulation, helps regulate blood sugar, and strengthens the muscles that support healthy foot function. Talk to your doctor before starting any new exercise routine, especially if you have existing complications. And finally, never skip your foot exam at your regular checkups. Every medical visit, take off your shoes. Ask your doctor or nurse to look. It takes 5 minutes, and it can catch problems before they become catastrophic. We've covered a lot of ground today. 10 signs, the science behind each one, and the steps you can take. I want to leave you with this thought. Your feet have been carrying you your entire life. Every step you've ever taken, they were there. And right now, today, they may be trying to tell you something important. The good news, and I want you to hear this clearly, is that early detection changes everything. Neuropathy caught in its early stages can be slowed, Circulation problems identified before they become critical can be treated. Wounds found before they become infected can be healed. The body has a remarkable capacity to recover, especially when we give it the support it needs. You are not too old to take care of yourself. You are not too late. And you are not alone in this. If this video gave you something useful today, I'd ask you to do 3 things. First, like this video so it reaches more people who need this information. There are millions of Americans living with undiagnosed diabetes, and something as simple as sharing a video could genuinely make a difference in someone's life. Second, leave a comment and tell me, which of these 10 signs surprised you the most? I read every comment, and your response helps me understand what topics matter most to this community. Third, hit subscribe if you haven't already. Every week, I bring you health information designed specifically for people over 60. Practical, evidence-based, and delivered in plain English. No jargon, no fear-mongering, just the truth. Next week, I'm going to talk about the #1 breakfast habit that is quietly raising blood sugar in millions of Americans over 60, and most of them have no idea. You won't want to miss that one. Until then, take care of yourselves, take care of your feet, and as always, your health is worth paying attention to. I'm Dr. Ethan Carter. I'll see you next week.